Africa is caught in the second COVID-19 wave, and the healthcare system is taking some strain. Over 24,000 people have died since the first case was announced. Our reporters are out and about monitoring the situation countrywide. Mankoba Mkunu is outside Charlotte Maxeke Hospital in Johannesburg. Spaman Lagoge is in Polokwane for us today, and Nobisutu Hejana is in the Western Cape, the province leading the pack in the number of daily infections. So let's go now to Spaman Lagoge. He's in Limpopo, and earlier he spoke to the Limpopo Health MEC, Spamanla, and just give us an idea of what information came out of that. What's the situation like in the province? It isn't quite a hotspot at the moment, but how are health workers coping?
Well, health workers are fatigued. They are psychologically and emotionally drained, according to Health MEC in Limpopo, Dr. Pobi Ramathuba, whom we spoke to earlier on. Let me tell you that that is the picture across the country. We have been speaking to some healthcare workers. Of course, they are not allowed to speak to the media, but those that we have interviewed have told us that they are really tired because they are overworked. And here in Limpopo, the nursing union, DINOSA, has raised the concern that there is a shortage of healthcare workers. A number of posts and vacancies have not been filled here in Limpopo. But Health MEC in the province is worried about the new variant and also the fact that it's affecting young people mainly. She says here for the past 24 hours, they've seen an increase in the number of positive cases. And in terms of statistics, they are looking at the younger people, the younger generation. And that is a concern because Limpopo is a rural province. You know, we are outside Pietersburg Hospital here. This hospital caters for COVID-19 patients, and also it's one of the referral hospitals in the province, the only two referral hospitals in the province. In terms of resources for now, there are no field hospitals here because the province has not had a high number of COVID-19 patients, but that seems to be changing based on what the Health MEC has just told us. But listen to her explaining.
We must indicate and tell people that psychologically, in terms of the workforce, our healthcare workers are exhausted. There is a lot of fatigue. What is making sure that this problem or exacerbating the challenge currently is that we are facing the festive season. When you look at this past weekend, how many people did you report died on the road accidents in this province? When you report an accident that 5 people died, it means you've got 20 that needed hospital admission. So the challenge that we're having is fatigue. It's the burden of disease due to trauma, road accidents, because we've got to be dealing with them at the same time. Whereas compared to the first, when we encountered the first wave, we were under hard lockdown, wherein the focus was on COVID-19, and mentally we were still prepared and stable.
Well, Spa, we know we constantly hear from health authorities, we hear from ministers, MECs as well about this, but you get a slightly different story from those who are on the front lines, those who are on the ground, who actually have to deal with these cases every single day.
Indeed, and I think those are the foot soldiers that matter the most, and those are the people who are at the center and the heart of fighting COVID-19 in South Africa and globally. And also they are not immune. A number of health workers have been affected and infected. So you are dealing with people who are really tired, but also they are high risk. Limpopo as a province has not been classified as one of those hotspots, but it's been placed on high alert level with the numbers slowly increasing. And that worries the nursing union, DINOSA, in the province. They say their members are overworked, they are overstretched. Let's listen to their provincial chairperson explaining.
We are grossly understaffed as nurses, especially as nurses. Despite that, this province is producing a lot of nurses. Only 2 years back, we've got more than 544 professional nurses, highly qualified nurses, who will be assisting us in COVID-19 management. They are at home. They are not being absorbed. I'm talking about the nurses who were trained by this department, but now they are at home, they are not hired, and we're having a shortage of nurses. So if the nurses were hired, we will be talking another story. But we just have a problem of their absorption.
We'll leave that there for now. Thanks very much, Spamana Goge there, just keeping an eye on what's happening in Limpopo for us there and what health workers have to say. Well, let's get to Gauteng now. That's where we find Manqoba Mqunu, and he's also been at various hospitals for us this morning. Manqoba, a very good morning to you once again. And yes, I suppose we have to wonder just, how Gauteng is actually faring compared to other provinces that are feeling the strain, provinces like KZN, provinces like the Western Cape, and how ready are we? Are we coping with a second wave, and especially when we have people coming back to Gauteng if they've headed to these other provinces for the holidays?
Well, you've heard many of the healthcare workers that you spoke to earlier saying that Gauteng is simply not ready to deal with the second wave of infection. Of course, officials are saying, on the other hand, that they do have a plan in place to deal with the second wave, saying that they actually do have over 2,000 beds that are still available at public facilities that will be used in the instance of the second wave of infections going up. And of course, the province remaining one of the hotspots for COVID-19, but those who spoke to earlier on, the healthcare workers, saying that there simply remains the issues of overcrowding, of staff shortages in some of the hospitals, which they say continue to be a major source of frustration on a daily basis. But I just want to bring in now the DA Shadow MEC for Health here in Gauteng, Jack Bloom, just to speak further about our readiness as Gauteng. Jack Bloom, we've spoken to some of those healthcare workers earlier on, and they are quite adamant that Gauteng is not ready to deal with the second wave of COVID-19. Is this the sense you're getting?
I think the problem is staffing. I think that there are enough beds. The province has built 2,000 extra beds. I don't know if they're located in the right places, but I think that the beds are there, but I don't know if there's the staff. And especially over the festive season, people have gone away, and I'm really worried. But at the moment, there's 1,700 COVID-19 patients in Gauteng hospitals. That's private and public. At the height of the epidemic in July, we had 7,500 in hospitals. So I think that tells you that we've got capacity for 7,500. They managed to cope. But I don't think we want to get as bad as that. I would still stress prevention mechanisms. But the other option, of course, is that the public sector should pay for public patients to be treated at private hospitals. There is an arrangement in the Western Cape to do this. I think this makes sense. And my problem is I don't think that Gauteng has made a similar arrangement with the private hospitals here. But I do agree that the problem is actually staffing. The beds are there, but where are we going to get the staff for all that? That's where I think there's been a lack of planning.
Okay. And in terms of another issue, the critical issue, of course, of personal protective equipment, that's been a big issue here in Gauteng. What are you hearing in terms of PPE? Do we have enough on stock for all those healthcare workers?
Well, I think this has been a perennial source of complaint. They've really had enough time to get enough PPE. There aren't supply shortages anymore. I mean, the situation was different, in March and April last year. The entire world was trying to get PPE. I'm just worried about the quality of the PPE that we're getting and the distribution. But I think this time round there's no excuses from the department. I hope there's not any more corruption there. And I think that we need to make sure that it's distributed properly to the right people and that nobody has to get ill because they didn't have proper PPE.
Okay. And then another issue, Jack Bloom, the province saying that they have a resurgent mitigation plan in place. Have you had a chance at all to look at that plan, and are you quite convinced that they'll be able to deal with this new second wave?
Well, I must be honest, the figures that we're given I'm not sure are trustworthy. There was a period when the number of active cases was lower than the number of people in hospitals, and it's only recently that they've started again giving us a district breakdown. So I think we need to have confidence in the figures to start off with, because if you can't track this epidemic, we need to know, is there a resurgence in this part of the province, in another part of the province, and then we need to also crack down on the super spreaders spreader events. I think that's the key thing. I think outdoor activities are much less problematic. It's indoor activities, people in close proximity to each other. And I think the big test is going to come in January when people come back from their holidays, from the coast, and we know that there's been an upsurge in the coastal areas. I think the big worry is when they all come back to Gauteng, and, you know, are we prepared to accommodate the influx of new cases?
Yeah, thank you very much. That was Jack Bloom, the DA Shadow MEC here in Gauteng for Health. Of course, raising some issues, but quite adamant that the system could well deal with the second wave of infections. There is enough capacity, he says.
All right, we'll have to cross fingers and hope that that prediction is true, Mankoba. Thanks so much. Well, let's go from Gauteng to the Western Cape now. That's where we find Nobesuthu Hejana. She's just been chatting to people coming in and out of hospitals there. They are facing particular challenges there in the Western Cape. Nobesuthu, good morning to you. And yeah, what are people saying? Are they a bit wary of coming to hospital for whatever it is they need? And how is the system coping there at this moment, especially with the second wave?
Well, Yuveka, the health department in the province did say that they will intensify their resources that they've used during the first wave to the second wave, but at the moment they're still deciding whether field hospitals like the Hospital of Hope will be opened as we see or check the numbers of COVID infections in the province. But I'm now joined by Marti Kutia. She brought her daughter here at the hospital for a checkup, and she was telling me that what she sees is a bit strange compared to what she's been seeing before COVID. Marti, what has been your experience coming to hospitals during COVID?
It's my first time now. I was 2 years here at the same hospital, and things were normal. My husband accompanied me with my pregnancy, and today I brought my daughter also for pregnancy. She's only 16 years old, but I can't accompany her. It feels like I'm letting her down. She must go on her own now and do things on her own. So it's very strange, and this pandemic, it hits us. It tied our hands completely.
And also understanding that hospitals are not only dealing with COVID cases, but also other emergencies or other admissions that people do come here for. And with that, they're also trying to limit the number of people coming to hospitals. But what do you think about the diversions because of these increasing cases? People who are now have to be taken or referred to other hospitals because hospitals can't cope with the numbers.
Is it necessary that they...
Well, we will have to leave that there now, but you get the gist of the idea there, just how people are very anxious and worried about going to health facilities. But let's take you here now. Public Protector Busisiwe Mkhwebane is releasing